25 years of trusted state government coverage. Our network is your platform to connect directly with Pennsylvania voters. Whether it's a presidential race, statewide campaign, or local cause, our viewers are ready to hear from you. Book your ad now. PCN, your access to Pennsylvania voters.
Travel with PCN across the state as we capture Pennsylvania's rich history and diverse culture. Journey back in time as we tour the state's many battlefields, listen to the stories of veterans, and hear insights from authors on the past. Explore agriculture with coverage of the farm show, or take a behind-the-scenes tour of how everyday items are made right in your community. Watch Pennsylvania's past and present come to life on PCN. PCN, proud to bring Pennsylvania history and culture to you. PCN is working to help keep Pennsylvanians informed as restrictions are lifted across the state. Join us for Coronavirus Impact, a discussion with civic, business, and government leaders on COVID-19's impact on life during and after the pandemic in Pennsylvania. Watch on cable and stream free on the PCN app.
This Sunday on Keystone Cuisine.
So let's go ahead and get our salmon. You see, it's nice and caramelized on one side. We go ahead and check it. Sitting at about a nice medium right now. We're actually gonna let this hang out for a few minutes. One thing I like to do is cook fish on one side only. What that promotes is a little more even cooking process through the actual fish protein itself.
Join our guests for insights on issues impacting local government and the citizens of Pennsylvania. Created by the Pennsylvania State Association of Boroughs, Inside Pennsylvania Boroughs connects you to legislation and policy that will affect you and your family. Your host, Chris Kapp, and his guests discuss current affairs that matter to you most. Connect with your state by tuning into Inside Pennsylvania Boroughs on Sundays here on PCN.
I'm here with Senator Maria Collette, Democrat representing Montgomery and Bucks County. Thank you for being with us today.
Thanks for having me, Liaga. It's my pleasure.
So recently, you and Governor Wolf announced the Hazard Pay Grant Program for frontline workers. Can you describe what this program does and why it's important?
Yeah, absolutely. And, it's really exciting to be here talking with you today. Of course, not under these circumstances, but COVID has really shown us what it means to be on the front lines, and we're seeing few signs that COVID is going to slow down. So this program, I'm really proud to say, is going to put money into the pockets of Pennsylvania's lowest paid frontline workers. These are people that are continuing to risk their own health and their family's health and safety. They keep us fed, they care for our children and our elderly, and they're helping their fellow frontline workers get to and from work safely. So this program is a $50 million program. It comes from those federal care dollars that we got, and we allocated it. The Pennsylvania General Assembly allocated this money for the hazard pay program. And for qualifying individuals, it means a bump of $3 an hour in their pay. So it is significant, and it is something that's actually going to go into the pockets of those workers.
And who qualifies for this grant, and how can they apply?
Sure. So there are a number of different frontline workers in different fields of work. So people that are in healthcare, people that are in some kinds of nonprofits, people that are part of public transportation agencies, businesses. There are very many varied types of workers that are eligible for the program. And typically, what would happen is an employer would apply for this program through the DCED website. That's our Department of Community and Economic Development. And we do also know that if there are workers who employer isn't applying for that program, workers can reach out through their CEDOs, their Certified Economic Development Organizations. And that will be a way that they can sort of mobilize and other workers in their business apply for and hopefully get this grant. Now, I do want to say that, there are so many deserving people in our convenience and specialty food stores, retail facilities, food manufacturing, transit, like we mentioned. Unfortunately, it is $50 million, and that is a finite amount of money. So we hope that with the success of this program, we'll go back to Governor Wolf and talk about reallocating even more dollars for hazard pay, because it really was clear and critical that these people kept Pennsylvania moving during the worst parts of our pandemic in the early spring.
Now, you represent parts of Montgomery and Bucks County. What is the trend of COVID-19 cases in your district these days?
So the good news is that we did see, we were among the first counties that started to implement procedures to mitigate and then to make sure that we were really taking part in everything that was going to keep the flow of this disease at a minimum. And so we started social distancing. We started making sure that we were staying home when necessary. And, the good news is that people in Montgomery and Bucks County sacrificed early, and that sacrifice has paid off in showing a slowing of those numbers. We did see that we were able to flatten the curve. We know that language now. I don't think any of us knew that language before COVID, but now we do, and we saw a flattening of our curve. Of course, there have been little spikes as we see an increase in cases because of reopening phases and maybe people relaxing a little bit, but we've got to be as vigilant as we ever were in making sure that we are adhering to those important guidelines. It's just what we can do to keep ourselves safe, to keep our families, to keep our neighbors safe, and to make sure that we don't see a resurgence of this as we head into the fall that could cause further shutdown. I think I don't speak for, I think I speak for everyone when I say that is the thing that we all want to avoid. And with the sacrifices that we have made and with our continued really good vigilance, we can make sure that we don't see a resurgence that's going to cause unnecessary hardships.
What are the main concerns that you hear from people in your district about COVID-19?
I think I have to say the people in the district are really incredibly dedicated to making sure that they are following guidelines to keep themselves, their neighbors, their families safe and healthy. But the biggest concerns really are about businesses and what the impact is going to be in the long term for us. People want to see their businesses thrive and succeed. People want to see that they're going to be able to go back to work and do so in a safe, healthy, effective way. And of course, right now, here we are at the end of July, and we are probably staring 30 days down from the start of our school year. And that has really been the thing that we're hearing more and more about from parents, teachers, bus drivers, the people in our communities who deal with our kids one-on-one, and trying to figure out what the best ways are so that we can have a robust and complete education offer to every one of our children, but doing so in a safe manner so that we don't overly expose children, their families, and of course, the incredible staff and teachers at all of our schools.
You and the rest of the PA Senate recently unanimously voted for a bill that would affect Pennsylvania's probation system. With all the protests going on at the moment, what are you and the rest of your colleagues in the Senate doing to continue to address some of these issues of criminal justice and racial injustice?
I'm so glad you asked. SB 14 was such an important bill. We were all really excited to have the opportunity to cast our vote on that and to send that even further down the line to get to the governor's desk. I think one of the things that we took away from those discussions really was trying to understand what more we can do, that although we've taken some incredible good steps forward, that we certainly aren't finished with that process. And so doing that, being part of that, is really figuring out what else we can do in regards to police reform, making sure that we are doing everything so that we're giving every member of our community an opportunity to thrive and succeed, but also to operate with the safety and security that every member of our community deserves. And so while we are really incredibly proud of the parole and probation reform measures that we've been able to pass, we know there is still so much work to be done. I'm really excited to be part of the Senate Democratic Caucus's Racial Equity Solutions Tour. We kicked that off. In fact, it was on my birthday, just Tuesday of this week. It was the best birthday present I could have had, to spend time with my colleagues hearing from really important community leaders about what we need to do to understand the intersection of all of these things: race, equity, poverty, opportunity, education, criminal justice reform. What is it that we need to do to understand how all of those things intersect and how we can start to piece together solutions? So I'm really excited about that. I'm looking forward to hosting my own local community event with leaders and activists in my area, so that we can start to discuss even more state legislation that's going to address racism here in our Commonwealth.
You also recently pushed for an initiative to get PennDOT funding for a project for a township in your district. What was the importance of doing that now?
Absolutely. So that had actually been going on for far longer than just through this pandemic. As it is, these things do take a long time to come to fruition. That project really would have enhanced lighting in an important part of a downtown area in the township that is seeing sort of a renaissance, a resurgence. We're trying to make sure that we develop areas in our communities where people want to live, work, play, where they want to stay, where they want to invest in their community, stay in their community. And this streetlight project is really something that's going to change the landscape and the face of that part of the community, so that the people they're attracting, the businesses they're attracting, know that this is a place where people are going to come to work and then rent an apartment or buy a home and stay. And this is so important to us because we know, living here in the 12th district, that there is an incredible amount to offer. We want to attract people to our community, businesses and residents alike, and improvement of this type is something that's really going to make sure that we just solidify what we already know, that the 12th district is the best place to work, play, and live in the Commonwealth.
And finally, what is some further legislation that you are working on or you would like to see to help continue to support people and businesses in PA during this pandemic?
Oh, thank you for asking. This has really been such a critical time for us. I'm really excited to be working on legislation that provides better support for frontline workers and residents, especially residents and staff in our long-term care facilities during this pandemic. As you know, I am the chair of the Senate Aging and Youth Committee, and I was a long-term care nurse prior to coming to the legislature. So working with our elderly population is so critical and important to me. And so making sure that the people that live and work in our nursing homes and long-term care facilities are safe, and that they feel like they're being heard, and that they feel like the family members who aren't living with them in those long-term care facilities are getting up-to-date information on their safety is really something that's very important. I have submitted bill memos with my colleagues in our Senate to create comprehensive guidance and reporting for nurses in long-term care facilities, to establish PPE stockpiles. I don't know if many of us outside of nursing understood the term PPE before COVID, but now we all do, to make sure that we have stockpiles for this crisis and for any crisis that we face in the future, and also to make sure that we are providing frontline workers with that prioritization for PPE and also for testing. We want to make sure we have good guidelines and workplace standards so that people are maintaining safety and health throughout this pandemic. It's been critical, and I'm really proud to sponsor some legislation that will go a long way toward that.
All right, Senator Maria Collette, Democrat representing Montgomery and Bucks County, thank you so much for being with us today.
Thanks, Liaga.
This Sunday on PCN Profiles.
Watching the WNBA on TV, I felt envious of the opportunity these players were having. And my husband and I were sitting there watching the games, and, you know, crazy notion we had was to try to make a comeback and see if I could play at that level. And coming back after having my fourth child, I thought you would think I was crazy trying to get back in that sort of shape.
here with Trish Hooper, Chair of the Pennsylvania State Alliance of YMCAs. Thank you for being with us today.
I'm happy to be here. Good morning.
So to start off, as more YMCAs open in the state, what are some changes that you've made inside the facilities to make them cleaner and safer for people to use?
So, one of the things that Ys across the state have been doing almost since the time that we closed down in March was working on how do we reopen safely and what does safe look like in each of our facilities, because we serve such a wide range of people with different health profiles, different needs. So we, individually assessed all of our facilities to make sure that we were able to meet all of the guidelines that were put out by the state. And then collectively came together to share ideas on how we made things work, what some of the best practices we were seeing across the industry. So, things like making sure that all of our equipment is properly spaced, providing enough, social distance for people to use the equipment, ramping up our cleaning, ramping up the training for our staff so that we can make sure that we're following all of the procedures, keeping our staff safe and healthy, keeping the facility clean, and making sure that we're still providing the welcoming environment that the Ys are known for.
You are also the president and CEO of the YMCA in Swickley Valley near Pittsburgh. Have you had to make any additional changes following the recent increase in cases in Allegheny County?
So we had a really good plan as we opened up, and we keep in contact with our local health officials to make sure that if there are changes that they would like us to make, that we're able to make them. And what we've done from the beginning is to screen all of our members who are coming in. We check them for symptoms of COVID. We check their fevers. We ask everyone to make sure that they're washing their hands before they use anything inside of the Y. And we've been doing that very consistently since we opened on June 8th. And it's helped people feel safe and confident about coming back into our facility.
Since this pandemic has affected so many people and like the YMCAs and many other businesses, they've had to be closed for a long period of time. Have you made any changes to the dues that people owe?
So, we were really fortunate whenever we closed because so many of our members stayed with us and continued to pay our dues. And I know that happened with Ys across the state. And that's because, Ys are more than gyms. So when we all closed down in March, so many of the 59 Ys across the state mobilized to do work in their communities. So we were doing food banks and food delivery and emergency childcare and outreach to seniors to make sure that they weren't isolated, delivering groceries, delivering prescriptions. We have a Y in Beaver County here who delivered thousands and thousands of brown bag lunches to kids who were missing out on their school lunches. The YMCA in Pittsburgh delivered 44 tons of food during the closure through their food pantries. And they, Ys that house residents have forgiven rents during the closure because people have lost jobs. So we've been really fortunate in that a lot of our members see the value that we provide to the community, not just our Y, but Ys across the state. And many of us were very fortunate to have our members stick with us and continue to pay dues.
Looking towards the fall, one of people's main concerns is how they're going to send their kids to school or their different childcare. What are some of the ways that Ys across the state have been addressing specifically childcare?
So the Ys across the state have been some of the key players in helping their school districts work through different scenarios for what school reopening looks like. Not only do we provide early child care at a lot of our Ys, and several of those child cares remained open during the closure, so essential workers could still go to work and have child care. And many of the Ys were among the first organizations to reopen their child cares as we moved into the yellow phases. And now as we think about the school year coming up, we're working with districts to understand how can we support virtual learning? What about the parents who can't be at home with their kids during the day? Can the Y be a place where their children can come, have the connectivity to virtual learning, but more importantly, have the help and the support of our Y childcare staff who have education backgrounds and, reading support backgrounds to make sure that all of our kids are getting the most out of whatever learning environment they find themselves in this year.
And a similar concern that people have is for senior citizens, because they're obviously a high-risk group. How are WISE addressing that population specifically as well?
So I think with the seniors, we are working really hard to keep them connected in the way that makes the most sense for them. Some of our seniors have no reservations about coming back into the facility, and they're happy to be back, and they're taking advantage of the WISE warm water pools, which help them with arthritis and, other physical limitations that they might have. But we also have a lot of seniors who are engaging with us virtually. So they're taking virtual classes, they're having virtual coffee hours where they're getting together with their friends over Zoom and having coffee. And these are things that wouldn't have happened in February. But, the closure and the pandemic has forced people to learn new technology pretty quickly to be able to adapt. And so we're finding that they want to connect in ways that make sense to them and help them feel safe. And lots of WISE are doing outreach phone calls to our seniors to make sure that they have what they need, transitioning some of our senior programs that were based in the facilities, but now putting them out into the community to continue with things like grocery pickup and prescription pickup and wellness checks, just to make sure that even though they're not in our facilities, that they know that they're still loved and cared for and a part of our Y community across the state.
You mentioned that you've been very fortunate that a lot of people have been able to continue providing their dues, but have WISE across the state received any aid, either federal aid or state aid?
Yeah, and I think it depends on the circumstances of the Y. But I will say that despite members continuing to pay dues and despite any aid that we've gotten, the closure has been extremely difficult financially on WISE, as it has been on organizations across the country. But some WISE have received PPP funding. Some have gotten funding through the CARES program to support their child care operations. The foundation community has been incredibly active and responsive to help to support not just WISE, but nonprofits, across all sectors to remain open, to be able to pivot, to provide their services in different ways during this time. Because, just because a lot of organizations had to shut their doors, it doesn't mean that the community needs have lessened. In fact, in a lot of ways, they've been magnified because of social isolation, financial pressures, things like that. So we've had to all, as a nonprofit sector, work harder and do our best to support our communities. And, aid that we've received either through the government or through foundations. And, for those of us who've been able to also keep our membership going, that's really made the difference in allowing us to weather this incredibly difficult time and keep doing what we want to do to support our communities.
And finally, as you mentioned, YMCAs are often known as just a gym or a community center. And you mentioned a couple ways that they've gone beyond that during this pandemic. Can you just describe a couple more ways that YMCAs across the state help their communities, or maybe communities have helped them that people may not know about?
Sure. So for instance, in Philadelphia, they'll be opening their city branches next week. But even though their city branches have been closed, they've partnered with the city of Philadelphia to launch the Play Streets program, where every day they close 320 city blocks within the city of Philadelphia, and they bring kids out to play. They give them lunch. They provide a safe, structured play environment at a time when there aren't a lot of access points for kids this summer. Pools are closed, parks are closed. So being able to do that, I think even when your facilities are closed, is a huge way that that's one example of a Y that's really serving its community. And throughout the state, we're providing summer lunches for kids. We're feeding families. We're providing shelter for people who have lost their homes or lost their jobs. And we're mobilizing food efforts. So people who maybe don't have access to come to a food bank, we're taking food to them. Across the state, that's happening. And I think that's really important work. And when you look at a Y, you may think that it's just a gym, but I would challenge anyone to find a gym that's done as much as the Ys have done during this closure. And frankly, in a lot of our communities across the state, the Y is probably the go-to nonprofit organization whenever there's a community need or something that needs to be addressed. They're reaching out to one of our 59 Ys, and it's an honor and a privilege for us to be able to serve in that way.
Awesome. All right, Trish Hooper, Chair of the Pennsylvania State Alliance of YMCAs, thank you so much for your time.
Thank you very much.
This week on PA Books.
There are many beautiful bridges that were in Pittsburgh and are long gone, long in a forgotten history, that are quite elegant structures.
We do have some very simplistic diagrams showing how the structures work, again, coming back to why these particular types of structures made sense.
Thomas Leach and Linda Kaplan, authors of Bridges, Pittsburgh at the Point, A Journey Through History, Sunday at 7 p.m.
Dr. William Hite is the superintendent of the School District of Philadelphia. Dr. Hite, thank you for joining us.
Thanks for having me, Corey.
So for the benefit of our statewide audience, can you just talk about the size of the school district and who it is that you report to, who you answer to?
Yes, so we are the largest district in the Commonwealth of Pennsylvania. We have some 206,000 children in public schools. That is a combination of district-run schools and charter schools. We have the largest population of children in charter schools of any in the state, with some 70,000 children in charter schools and some 80 plus charter schools here in the city of Philadelphia. I report to a board of education that, unlike other boards in the Commonwealth, do not have the ability to generate revenue. Those board members are appointed by the mayor and must be confirmed by a 17-member city council. And all of that is based on the City of Philadelphia charter.
And your funding comes from what mixture of city versus state versus federal?
The funding comes primarily from the state and local government. So it comes from the city and the state, with now the city they're either equal to or slightly above the state funding because of the increases over the past several years. And less than 10% comes from the federal government.
So let's talk about the pandemic. You were forced to have to change things very rapidly in March. And looking back on it now, how do you think you did?
I thought given the circumstances, we did as well as one would expect. And what I mean by that, Corey, I would have loved to have moved more quickly to getting children into a virtual environment. But unfortunately, because of inequities that exist in cities like Philadelphia, we had to first ensure that children had the necessary technology to access the virtual information. We had to make sure that children were fed. We had to make sure that children had received their medications that were in schools. We were making sure that children had shelter. And so all of those things then delayed our ability to get children up and online. But once we were able to do that, we distributed some 86,000 Chromebooks. We have now fed or provided meals for 3.7. We've provided 3.7 million meals since children left in the spring. And we had children who were able to do enrichment and review and continue to do their schoolwork digitally. And it wasn't perfect, but by the same token, it allowed us to have a practice run, if you will, for what we may be seeing in the fall. In addition to that, we had some 7,500 teachers who were trained on how to use the digital platform. And we had individuals that then had to stand up digital content for day-to-day instruction for a period of 2.5 months for our young people while we were out.
Can you talk a little bit about that digital divide? How many students were there that actually did need assistance getting not just a Chromebook or a computer, but also just access to the internet?
Yeah, so we have some 206,000 children. And when I think of the children educated in public schools, I'm also thinking about the children in charter schools here in Philadelphia. And quite frankly, they had many of the same challenges because they are educating similar children. And so with that, we probably had in excess of 100,000 young people who needed either some form of the technology or the access to the internet. And so we've been working on a plan to ensure that regardless of where children are in the city of Philadelphia, they will have access, and we want to begin the fall that way so that if we have to move to an all virtual environment, we have the means to do that.
So when you talked about your plan for reopening, how did you approach that? Who did you look to get guidance from?
So we've gotten guidance from lots of different organizations and institutions, and we've worked primarily with the Center for Disease Control, the Health Commission of the City of Philadelphia, Philadelphia Department of Health, with the Children's Hospital, CHOP in the Policy Lab at the Children's Hospital, and national and local experts, particularly in the health fields and the education field. We also sent out surveys, and some 36,000 individuals responded to the surveys that gave us information both about the experience in the spring and what people expected for the fall, or would expect for the fall. In addition to that, we've had 5 virtual town halls, and those were content-based. So we had 2 on health and science, 1 on facilities, 1 on transportation and operations, and 1 on student support services. I think 1 was on instruction as well. But those actually provided us with more feedback about what individuals wanted to see with respect to preparing to get children returned in the fall. In addition, the Philadelphia Federation of Teachers did a survey. We considered the responses of their survey results as we developed our plan. And so through all of that, then we developed a plan. And that plan is a hybrid model. And the hybrid model has children coming to school 2 days a week, and they would be receiving digital instruction 3 days a week. Children with special needs that have more complex needs, those children will be 4 days a week. And then pre-K children, our youngest learners, will also be 4 days a week. Everyone else, and English language learners will be 4 days a week. And everyone will be 1 day digital, and then everyone else but those 3 groups will be 2 days a week face-to-face, 3 days a week in a digital environment.
Let's just talk about the survey a little bit and the questionnaire from the teachers. What were some of the major concerns that you got from those sessions?
A lot of concerns were around health and science. Corey, a lot of individuals wanted to make sure that we had the appropriate guidelines and protocols for masking, for distancing. There were many, many concerns about our physical environment. We, like many other districts across the Commonwealth, have lots of old buildings that have been, for a variety of reasons, in disrepair. And so many individuals are concerned about ventilation, the ability to sanitize many of these old buildings, the ability to ensure that there's a constant airflow in the buildings as well. So many individuals are concerned about that. And then people were very concerned about what happens when someone contracts the virus, then what happens with everyone else and within the environment. And then there was quite a bit of concern around student transportation, particularly those students who take SEPTA to school. And if you're in the city of Philadelphia, regardless of school, district, Catholic, Independence Mission, charter, if you're in the 7th through 12th grade, SEPTA is your mode of transportation. So many individuals are, and rightfully so, worried about SEPTA and the guidelines that will be in place while children are coming to and from school on mass transit.
Speaking of that, how are you going to maintain proper distancing and all of that? So, because there are some buses that are primarily for busing students, even though it's public transportation, there's a lot of buses that go directly to schools. So is that part of staggering the students 2 days a week on and off?
It is, and so that is a part of it, but even beyond that, the mass transit, and I'll talk about the mass transit versus our bus system. With the mass transit, they already have guidelines in place of seats that cannot be utilized to maintain social distancing. They will have more buses during the arrival and dismissal times for particular schools, although we will only have half of the student populations on those days. That's number one. On our buses, the buses that we run, we also are practicing strict social distancing. Children will be no closer than 6 feet, and buses will be sanitized after each run. So, Corey, that means that a bus that normally takes 44 children may have at maximum 15 children, and it will allow for us to maintain social distancing, the appropriate social distancing, but also to sanitize the buses after each run.
So some people might say, why reopen the schools at all? Why not just stay virtual until there was a vaccine?
A couple of reasons. I mean, and as an educator, one of the things that I constantly study is the research, and the research around what outcomes are we generating with the models we're using. And one of the things that we now know for a fact is that children, particularly children from more vulnerable communities, and more particular, children from circumstances of poverty, are impacted disproportionately when they do not have access to face-to-face instruction. And so we could continue virtually, but then we have large groups of children who are falling further and further behind. That's number one. Number two, the children are traumatized, particularly our youngest learners, by not being around their friends, not engaging with others, not engaging in learning activities. And so we have to also manage that. And then the third part is we have no idea when a vaccine will be available. And this could go on in perpetuity for all we know. And so I do think that as what the other things we know, children contract the virus at much smaller percentages than adults do. Now, that we don't know if in fact children are passing the virus from one individual to another, but we do know that they contract the virus at lower rates than us adults. And so therefore, if you balance that, the health experts out there would say, yes, there are things that you must consider on the virus side, but you also have to consider the growth and development of young people on the educational side. And it's really important that even if we have to get children to school fewer days, it's more important for children to be there than not.
And so groups of students will be there on different days, two per day or 2 per week for each group. What about the teachers? Are the teachers reporting to school every day?
Teachers would be reporting to a place every day, a school, maybe a classroom every day, unless there are vulnerabilities with that individual or medical reasons why they cannot. To your point, and I'm glad you made this point, children will see a teacher on Monday. I'll walk through a schedule. Children will see a teacher on Monday. They'll be face-to-face with that individual. On Tuesday, they will be doing work from Monday's activities to build off those activities. They will see the teacher again on Wednesday. And then on Thursday, they would be doing work from Wednesday's face-to-face lesson. On Friday, all of the children in that class will then be led in a digital environment by that teacher. So the children will still see other individuals in their classes, albeit one day, even though they're separated.
And what about the teachers? Are there any concerns that you said younger people are less affected by the virus, but those who are in older age groups are more at risk. Have you heard anything from your teachers with concerns to that?
Yeah, we've heard lots of concerns. And naturally, I'm also equally concerned about our workforce and making sure we maintain safety and health for all of the employees, not just the students, in addition to the students and the families. And so very concerned about that. And so we have 4 individuals, and I don't think I talked about this earlier. We have the ability for any family member who wants to remain completely virtual to remain virtual. And that means we will have a need for teachers to be teaching in that virtual environment. And so if individuals have vulnerabilities or if they have medical reasons that do not allow them to teach in the hybrid schedule, then they can also teach virtually from someplace other than a school location. And so
you're talking about the Digital Academy?
Yes, the Digital Academy, yes. I'm sorry, I'm using virtual and digital interchangeably.
Obviously, the economy has been hit by this. Taxes have been affected by this. What is the status of your funding going forward, and how much is this virtual instruction going to cost?
Yeah, we have an estimate, Corey, of somewhere between $60 and $80 million. So, and it could be lower. I hope it's lower, but that's in addition to all of the funds that we've already received from the CARES funding that was released earlier, which was $113 million. And so everything from PPE to transportation to hiring more custodians to hiring, in some cases, more teachers, to getting the equipment like electrostatic sprayers in all of our schools, all of those things take resources. And we've then done an estimate that those resources will be somewhere around $60 to $80 million.
And your funding levels?
The funding levels are staying the same. I mean, I think, and that was, thank goodness for the General Assembly that maintained level funding from the state and passed through, and they passed on to all of the districts the money from the CARES Act. That was exceedingly helpful for all the school districts in the Commonwealth and for us here in Philadelphia. That at least gets us through this year. We are facing deficits moving forward, and we're going to have to work on how do we resolve those deficits, particularly given all of the shortfalls from our local revenue sources.
All right, well, we'll end it there. Dr. William Hite, thank you very much.
Of course, always a pleasure. Thank you.
Travel with PCN across the state as we capture Pennsylvania's rich history and diverse culture. Journey back in time as we tour the state's many battlefields, listen to the stories of veterans, and hear insights from authors on the past. Explore agriculture